with a smile on your face. When you're moving from place to place. Good morning, good morning, morning, good morning, morning.
Good morning and welcome back to Youth Wednesdays and Tobago Updates Morning Show. You're viewing us here live in Portmore in Scarborough, Tobago. My name is Dwayne and I'm joined with Miss Natalya Nancis, and we're going to take the discussion across the aspect of physiotherapy, and we have none other than the renowned Roston Wood. Good morning to you, Mr. Wood.
Pleasant good morning to you. Pleasant good morning to the whole of Tobago and to the wider community.
Yes. All right. Are you comfortable, Mr. Wood?
I'm certainly.
You gotta ensure that the physiotherapist is comfortable.
Yes, I'm right. Very comfortable.
So
this
just
morning.
Tell us about yourself and just a little bit of what you do in terms of your profession.
Well, my name is Roston Wood, and I've been a physical therapist for over 10 to 15 years.
Okay.
And since we're talking about stroke, I've been treating all different kinds of stroke, and it has been fun. And I'm here to just educate people more about it.
I just hope that you don't laugh the patients.
No, Dwayne, I think that's a you thing. That's just you.
No, I'm not a physiotherapist. And why would I laugh at it? No.
You make jokes.
No, physical therapy is supposed to be fun, eh?
Okay.
So we are hard at times, but we do make our treatment session as fun and as enjoyable as possible.
And that is for the benefit of the patient, yes?
Yes.
Yes. Right. So, Roston Wood, owner of Holistic Physical Therapy Services.
Yes.
Right. Physiotherapist for 10 to 15 years, well versed. So you're able to answer our questions this morning.
Yes, I will try as best as I can.
Right. So when is the physiotherapist called in? Seeing that we are talking about stroke and stroke victims, when is the physiotherapist called into the situation?
Well, at first you have to ensure that your blood pressure is regularized. So as the doctor said, after they have treated the patient and ensure that their blood pressure is regularized, then we come in as soon as possible.
Okay. And what is the initial treatment like? What do you analyze first before getting into, besides the blood pressure that you just mentioned? What else do you look at in terms of the patient on a whole to know how to proceed with your procedures?
Okay, well, our assessment is very long, but for today, and to make it very simple, we look at three simple things. We look at the body area that is affected, and then we look at the activity limitation, and then we also look at participation restriction, meaning that we look at the simple activities that you have in challenge with, and then we also look at the activities that you cannot do.
Okay.
Right. So, for example, you might not be able to brush your teeth. You might not be able to hold a cup, right? Those are the activity limitations that you may have. But the participation restrictions, for example, we just came out of carnival. You might not be able to jump and whine and stuff like that. Right? So those are some of the activities that you might be restricted, that you might not be able to do because you have the stroke.
Okay. My question is, how do you assess the area? Is it scaled based on a percentage performance? Because sometimes when you go to the hospital and an organ is dying, they may say, well, it's 2% functional, 5% functional. What scale measurements do you use to assess the functionality of a affected area?
Well, we do have some functionality scales that we use to assess the patient. So, for example, in terms of your strength, we do have different measurements that we use to determine how strong a person is, how functional that person is. So these are some simple things that we use just to gauge where they're at and where we could take them from.
All right. Have you ever treated a patient that had a stroke so severe that you really have no feeling at all, don't feel nothing, and what was that like dealing with those severe patients versus those who might have had a milder stroke than others?
Well, we normally have stroke in two ways. One way, we will have a stroke patient that is like very, 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 very rigid, that they can't move their hand at all, or just like what you said, that they just have no feelings at all, that they can't move. And you have to craft your treatment in a certain way that would encourage them, and the treatment doesn't only involve the patient, but it also involves the family members as well.
Right.
So it's a whole collaborative effort in terms of rehabilitating the patient.
And what would you say, based on those two categories you just outlined, might be the recovery time for these things? Is it 6 months, 3 months, 6 months, a year, 5 years, and so on? Before we talk about price, you know, yeah.
I'm normally reluctant to answer a question like that because if we normally, physical therapists, if we normally give a patient a certain time, even though there is an average time, we all are based on our lifestyle, we would recover
Yeah.
differently.
Yes.
So sometimes if you rush to tell a patient, okay, it will take 6 months or a week or so, and that time pass and it doesn't, and they don't see significant progress because the stroke affect people in different ways and they recover in different ways, and the timing in which they recover is different, and how eager they are to do the exercises.
Yes.
Right, and how and if they're able to follow the instructions properly and stuff like that. It would affect the recovery period. So sometimes we are kind of reluctant to tell patients how soon they will get better, but we more would encourage them to do the exercise and help them psychologically as well too, because it will take a toll on them and their family members as well too.
All right. You know, there are some professionals who get down in the trenches with their patients. They cry with them, you know, they laugh with them.
Is that you, Roston?
Are you that type of thing? Do you cry with your patients? You know, are you just there, you know, like one of those, you know, posts, just strong and moral support?
Not necessarily cry, but I do laugh with them. Again, as I said earlier, we have to make the process as easy as possible because it is a little bit hard, it is a little bit challenging. But once you're at it all the time, once you're consistent with your exercises and also with the assistance of your family members, and I really want to stress this: stroke rehab doesn't involve the patient alone, it involves the family members as well too.
The support.
So they too will have to be, let me rephrase that. They too should be a part of the rehabilitation process.
Yes.
Okay. And for the patients who may have suffered paralysis in one or more areas, could you demonstrate, using Dwayne of course, some of those exercises that can be done for them to keep fit? Because I know that paralysis is one thing that they'll be dealing with, but also keeping fit during the process of it. So are there any exercises that can be done for a paralytic patient?
All right. I want to take a different approach.
Okay.
I want to say that your body is an excellent compensator.
Right.
Excellent compensator. And your body will do what it needs to do in order to accomplish its task. So, and I will demonstrate it to
you using Dwayne, yes, of course.
So you might say that, okay, I'll just go down by the beach and I'll get good, or I'll just go to the gym and I'll get better. But if you really look at how the person is moving, and you look to see what is your normal movement, then you will see the difference. And that is where we come in. We have the eye to see what is an abnormal movement and how you should and the correct way how you should move. And that's how we craft our treatment. That's how we craft our exercises in order to get you back to where you were before or even better.
Okay. Well, I was just about to ask that question. The doctor said that some of your procedures are different to avoid having that person have a recurrence in the stroke, the whole stroke condition, right? What are some of the exercises that you might do to prevent the recurrence of a stroke?
Well, simple exercises like you're walking and
I could do that. Yeah.
Yes. Walking, running, and stuff like that. These are some simple. It's just to be active. Most of us live a sedentary lifestyle.
Yes.
And because we claim that we are quote unquote so busy that we don't even involve a little time to do some exercise. And as simple as 15 to 20 minutes. Sorry, let me rephrase that because I don't want people to, when they say 15, they'll say, all right, exact 15 and that's it, right? Normally we say about 20 to 30 minutes exercise every day or every other day. That should be sufficient for somebody. But what you should do is incorporate your exercise in your normal activity.
Right. So before we wrap up, we're gonna go quickly into some of the demonstrative exercises.
I was just about to say Dwayne was going to run away from these things.
Yes, I knew that.
But I want to see some of these demonstrations. Last time I was the guinea pig. Here's Dwayne.
I just want to show you just one simple thing, how your body could easily compensate for when you have a stroke, right?
Yes.
So Dwayne, I just want you to hold out your hands straight for me, right? No. Hold your fingers straight, right, to my hands. Good?
Yes.
Now this is somebody who is normal. Right? They will have their hands straight like this just to hold my hands, right? So I'm going to just lower your hands a little bit and bend, right? And I'm going to try to keep my hands like this and ask Dwayne, without moving your hands, to try to touch my hand. Try and touch my hands.
You could lean
Do what
forward,
you have to do to touch my hand. You see? So that is how you simply, and if I raise my hand a little, try and touch my hand. No, without standing up. Right, so he has to raise, he has to lean forward, right? And sometimes he will turn his trunk in order to raise your hands. Yeah. And that's how your body compensates in order to accomplish the task that it's supposed to do. So what we do, we look for these simple changes, or I would normally call it bad habits.
Right.
And we will craft for exercises that will able for him to move normal. Right, what could cause this movement is these muscles in his scapula is not firing properly, and that could be one of the causes of the stroke. Right, so we, based on our exercises and on our tricks that we have up our sleeves, right, we are able to get that patient back to how they're supposed to be. So let me just say this before we run, because I know we are short
a little
on time.
press of time, but that's okay.
Yes. Always trust your physical therapist. You should see your physical therapist as soon as possible, right? Don't just go down and have somebody just rub out your fingers or so, because we like that.
Yes.
Understand? Always see a physical therapist first. We are trained to look for any abnormalities, and that's how we craft our treatment in order to get that patient back to how they were before.
Okay.
All right. I want to thank Mr. Wood for being here with us. I'm going to get my therapy in a short while, guys. Thank you guys for joining us, and this brings us to the end of Youth Wednesdays on the Tobago Updates Morning Show. This is Natalya Nancis and Dwayne telling you to share the life, share the life, share the life. Have a great day.